All right, hey, here's some chapter highlights for chapter 4. I'm going through the chapters assigned for the first 2 weeks of the course backwards. We started with chapter 5. That's listed at the end of the module. Now I'm looking at chapter 4. Kind of an interesting chapter. The only couple of things I want to say about it. On page 34, I think what's said here in the left column, first full paragraph, kind of brings out something that we'll return to, especially when we talk about emerging practice areas. You'll read and hear a lot about all the areas OT is becoming involved in, but you've always got to ask, is it sustainable? What pays for OT in that setting? Because when we only talked about the hospital setting, we never talked about what pays for OT because it's always covered under hospitalization, healthcare. But when we start talking about community-based practice, there's a lot of great ideas. Some of them get started with grant projects. Some of them are fee-for-service. Generally, they're not covered by health care, and so what might be a great idea for OT doesn't necessarily happen because there's no funding for it. So, for example, the end of this paragraph, it says, OT practitioners are meeting the need for older adults by developing expertise in Alzheimer's disease and dementia, low vision, or community mobility and driving. And that's true, but there are not standard running programs separate from hospitals and usually not in hospitals that would pay OTs to provide these services. Some of these ideas come out of grants that were temporary projects, and the book is not good about saying what are typically funded areas of OT versus what are great ideas for OT for which OTs have training. So I want you to keep that in mind when you read about different settings for OT. Same page under Community Health and Wellness. It says, OT practitioners facilitate health and wellness in communities through education programs and services to individuals and groups. And for this, I really want you to go to our OT website for CSU OT and look under Centers and Research when you go to that website, and I want you to look up Center for Community Partnerships and understand that they offer some really unique community-based services, and they are a combination of grant-funded and project funding, program funding that is sometimes temporary, sometimes depends on if grants are renewed. Sometimes they're specifically fee-for-service, but they're rarely covered by insurance. So this is a good example of a community-based set of programs that have to be pretty creative about their funding to be able to hire OTs. Same thing for assistive technology. While you're on the OT site, look up the Assistive Technology Resource Center, ATRC. They're funded, in this case, by the university, and that center here in our OT department is responsible for all the ADA compliance for students who need adaptations for computing as they complete their student assignments. Okay, so keep in mind the funding. I wanted to mention something about on page 35, needs of children and youth, and they bring up Healthy People 2020 and the need for services for prevention of childhood obesity. And the book talks like OT is equipped to do this on its own, I want to point out that this is a perfect opportunity for OTs to work with nutritionists. OTs don't possess all the skills and knowledge necessary for every project imaginable. So keep in mind when it's a good opportunity for OT to work with other professions in interprofessional efforts. Page 36, I want to bring out in the top left-hand column that the book does a pretty terrible job of representing OTs in school systems. And just keep in mind that the primary role of OT in the school system is to work within the educational context, work with special ed teachers, regular ed teachers, paraprofessionals, speech therapists, work with children in the classroom to help promote learning based on their needs. They work with positioning, they work with fine motor development, handwriting. In general, they look for ways to structure and organize the classroom to promote attention and learning among the students with special needs. Okay. The last thing I want to point out is box 4.1 on page 38 has a pretty good summary of laws that have affected OT, and some of those have affected OT funding and made OT possible. And then there's a nice section on primary care and the number of things that OT has to offer by being allied with, say, a primary care physician. And this is a developing area for OT. It's not a lot of OTs working in primary care. That hasn't been really given a lot of shape yet, but there's a lot of ideas about what OT would have to offer. Okay, that's all for Chapter 4 as far as highlights that I want you to be thinking about. Thanks.